You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, no more migraine headaches, new breakthroughs in the treatment of migraine headaches. With us, we have an expert on the topic. He's getting amazing results with his patients, Dr. Greg Pyle. Dr. Pyle, welcome to the program.
Hi, Randy. Thanks for having me back.
Okay, good. So now we should start off with the results. So you are seeing people that had migraines for many years, and because of the treatments you're doing in your office, they're going away.
No more migraines.
Is that right?
Okay. No medications, no needles, no more migraines.
Now, for people that don't know you, and we've had you on the show before,
Right.
talking about sleep apnea and things like that, tell me a little bit about your practice. I mean, who's the typical patient, and what are the different procedures that you do?
Okay. We have a general practice. I've been in practice for over 20 years. Our typical patient is like everybody's typical patient. They live in our hometown, where I grew up, and now I practice dentistry. Many of our patients are friends. So we have young and old. I saw a 2-year-old just last week, as well as a 92-year-old.
Okay.
So we see all different patients.
Okay, so what are the symptoms, by the way, where migraine headaches might be connected to a bite problem? I guess the way the teeth come together.
Right.
Because what, there's nerves right here?
Oh yeah.
I mean, obviously.
There's nerves all throughout, and they're all interconnected from this trigeminal nucleus throughout the head, as well as the teeth themselves. But symptoms would include, jaw pain. Symptoms include TMJ issues, or that joint that gets sore in the morning. Obviously, headaches and migraines. Ringing in your ears, tinnitus. That's another symptom.
Could be a bite problem.
Could be a bite problem. Yeah.
All right. And clicking?
Clicking and popping, that's part of the TMJ issue. Neck pain is part of it as well. So grinding as well, teeth that are flattened off, we see it every day in our office. I'm sure many of the patients that say, yeah, my dentist told me I grind my teeth, but I never really followed up on it.
You say people don't know they grind.
Right.
It's because they do it when they're sleeping.
A lot of times they do it when they're sleeping. A lot of people do it, believe it or not, during the day, but many people do it at nighttime. They claim that they don't do it, yet we see teeth that are ground off and flattened. When they are grinding, they're putting a lot of pressure on a lot of things. Not only just the teeth, they may have ground down teeth, but they also might have discomfort up in this joint. They may have clicking and popping. People ask me, they say, yeah, my jaw clicks, and it's very common, but it's not normal. Your jaw shouldn't click. It should be a well-oiled machine when you open and close.
Now, with this new method, it's called TruDenta, is that right? So what are you doing now that's different than just the splint therapy you were doing in the past? And why does it work so much better?
Well, like I said, we saw patients with the splint therapy that it worked fantastic. We saw patients who it worked okay, and we saw patients that didn't really work at all. And so several physicians started utilizing things that were being used in physical therapy and for highly skilled athletes, where they were using different modes and methods to decrease inflammation, to get athletes back onto the field faster, back onto the court faster. And so they started applying that to the head and neck as far as TMJ and jaw and headache therapies. And that's where TruDenta came in, and they developed a system that has really pushed us over the top. And so patients who we saw who had the orthotic but still were having headaches, we're now seeing results where they're virtually headache-free, and if they're not headache-free, they have a way to combat the headaches without using medications.
So how is it different and better, and why is it more effective than just fixing that bite with some sort of, I guess, orthotic or splint or whatever?
Right. Well, the orthotic or splint was you put something in and you cross your fingers or say a little prayer and hope that it works, and it did, like I say, in many cases. But in many cases, it didn't work completely.
So this cold laser, I mean, what's it doing? What's it supposed to be doing?
Well, it decreases inflammation. As you know, inflammation is the enemy of all of our body parts. And anytime you can decrease that inflammation, we're going to decrease pain. And so the laser therapy goes on all the muscles, which are being overworked from clenching and grinding. But the problem was these people were wearing the orthotics at night, but they were still doing some things during the daytime, which kept them in an inflamed mode all the time. And so we needed to find a way to decrease that inflammation for those people who did things during the daytime.
Okay. What else are you doing?
We're also doing ultrasound therapy. And the ultrasound, we go over trigger points in different muscles, and that breaks up scar tissue and helps break up the trigger points. as well as some manual muscle therapy, which also helps break up those trigger points.
And you have a therapist that works in your office?
We do, Krista.
So how long does this take? I mean, a typical appointment, once they're involved, once they say, okay, I'm going to move forward with the treatment.
It takes about an hour, and it's hour to an hour and 10 minutes. Very relaxing. Many patients come in with a headache and leave without one, which is, that changes their day right away. In addition, we also use a TENS unit, which stimulates muscles. It's kind of like warming the muscles up before you go exercise, doing a little stretching and getting limber. That's what the TENS unit does for us.
Okay.
It's real mild, but it stimulates those muscles so they're a little looser. So then our therapist can go in and do some manual muscle therapy.
So it's like physical therapy, but for the jaw.
Yeah, exactly.
Is that right?
Yeah.
Are you ever surprised with the results?
Astounded, actually. And we had a patient come in she's a school teacher. She's been under a lot of stress with their job. School teaching is very stressful. But she had a headache that wouldn't go away for over 10 months.
Okay.
And she came in and was very skeptical of what we were doing.
10 months straight with a
10
migraine?
months straight with
Like every day?
Every day.
Interesting.
Yes. So 0 days a month without pain. And she would come in, she was very skeptical, kind of had one eyebrow raised when we were telling her about the therapy. But now she's a believer because since she finished her therapy, she hasn't had a headache since. And it's been incredible for her, life-changing.
How soon? Okay, so you did the consult on this woman.
Mm-hmm.
You evaluate her.
Mm-hmm.
How soon before you think or know they'd be a candidate?
Well, we first evaluate what she's gone through. Has she done other testings to make sure that nothing else is going on? Has she had an MRI or a CT scan, make sure there's nothing else going on in the head and neck? And if not, then we're pretty sure that it's muscle related, and when it's muscle related, that's something that the TruDenta system can help.
Now you say some people are on medications, they're off medications.
Right. Yeah, the lady we were just talking about, she's completely off her medications now, still no headaches. She was a combination therapy because she had some sleep apnea issues also. But between the two things, she is completely pain-free, completely drug-free. And it's been life-changing for her.
Good. So this is not a gimmicky procedure. You know, when going into today, I hear, okay, I'm interviewing a dentist about migraine headaches, but the bite, okay, if you're having symptoms, sore jaw, you're clicking, bite's not coming together, the nerves, you're saying, go to the head and are causing a migraine headache.
Right.
That's the premise. So you do this procedure, this TruDenta procedure, and you're kind of relieving that nerve or reducing inflammation, and their migraines go away.
Right.
So how many treatments usually?
For the most severe cases, it's about 12 treatments, so 12 straight weeks in our office.
Okay.
For the minor ones, sometimes it still is just making an orthotic for a patient. Sometimes it's anywhere from 4 to 12 sessions, though. Just depends on their severity, and also depends on the cause. You know, we try to get to the root cause when we do our evaluation.
So you classify them into different levels,
Right.
depending on how many sessions they're gonna need. Elaborate on that.
Well, we look at their red flags in their evaluation. You know, how many symptoms and signs do they have, whether it be ringing of the ears or the tinnitus, or do they have severe problems with their bite or whatever it might be. And we classify those into how many sessions do we feel they'll need. And some people are level 1 where they still only need just an orthotic. Let me give you an example. We had a level 2 patient. She heard us on the radio. She heard an ad about our headaches. We were actually treating one of the radio guys, and so she actually kind of knew him and put 2 and 2 together and came to our office. We classified her as a level 2, which is 4 sessions. Okay, so the first session we go through and we use the TENS unit and the ultrasound and the cold laser and the manual muscle therapy. We also use anti-inflammatory lotion that during those therapies, as well as making the orthotic.
Okay.
So she started wearing the orthotic after the first session. She goes through 3 more sessions and she's headache free now. No medications, no ibuprofen, no stomach aches. So yeah, so she's headache free, but what that really means is she can go to class and be able to concentrate on what the professor's saying, or she
Good
can,
point.
at the end of the week when she doesn't have class anymore and her friends want to go out and do something, she doesn't say, no, I'm too tired. She keeps going, and she's got a lot more energy, and just life is more fulfilled.
I guess you're more motivated. I mean, look, I think I know one person with a migraine problem.
Okay.
And she is miserable.
Right.
And it's like, stay away from her when she has migraines.
Right.
That's why when I'm thinking about this treatment, I'm thinking, I mean, everybody with migraines should give it a try.
Oh,
obviously.
Yeah, there's no question.
But it sounds very hard to believe.
Well, and like we said earlier, there are 80 million people who suffer from headaches. There are a lot of people who just push through every day thinking this is just normal. This is how I'm supposed to feel. I'm not supposed to feel 100% all the time. And they don't realize that they can feel 100%.
Okay, good. Now, we're going to take a quick break. We come back. Questions about the process, what they can expect on day one.
Okay.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We'll be right back.
And I noticed a huge difference. It wasn't until, after maybe 2 treatments, it felt really nice and I wouldn't have the headaches anymore, maybe once in a blue moon. And then one day I was driving, I was like, oh my gosh, I haven't had a headache in forever and my jaw isn't hurting, and it's just helped so much and I love it.
Yesterday I really went through one of the sessions, the therapy sessions, completely for the first time, and my range of motion and my opening was dramatically increased, and I woke up this morning without a headache. So I'm very, very excited about it. It was the first in a long, long time. I could cry about it right now, but it was the first.
It's just been the most amazing experience, which I had never heard of before. And no one I talked to who was wondering why I was driving to Philadelphia from Delaware to see a dentist all the time could believe or had heard of this. So I'm really thrilled that I had it done, and I'm happy to share this information with you, and I hope and know that it would also help you.
Well, I was having headaches and jaw pain in my jaws. It was really bad. I don't really have headaches, or if I do, they're small, and I can do the treatments that you gave me, like the home care, and it'll get rid of the headache, and I don't have to take medicine.
What would you say to somebody who's thinking about doing TruDenta therapy?
I would advise them to do it.
Yeah.
Soon.
Yeah.
You're watching The Wellness Hour. I'm Randy Alvarez. We're talking about no more migraines, according to my guest here. He says the people are coming in with migraines, long-term chronic pain sufferers, and they're being reversed in some cases after just a few treatments.
Right.
Is that right?
Right. And the big thing is, are the medications. And so many people are on prescription medications or ibuprofen or aspirin or Tylenol, and all of those affect your system. That's what they're supposed to do. What we found out also, there are several studies out there about it, is that the longer you take these medications, the less effective they are. So you have to take more of them.
But these medications work.
Well, sure they work.
Oftentimes. Make it tolerable.
Yeah, they make it tolerable, but nobody wants to be on medications. That's one more thing you have to do during the day. You have to, I have to take my medications. Or if you wait too long to take your medications, then it takes them longer to kick in. Pain medications work best when you take them before the pain arrives. So some people are even over-medicating, and there are studies out there now about headaches and migraines that are caused from over-medication. And so to be able to
And the
offer,
side effects, obviously.
Oh yeah,
It's a list of side effects of medications.
We don't have enough time to go through all the side effects. All you have to do is watch one of the commercials for these medications, and they list all the side effects, and you think, gosh, the side effects are much worse than the headaches themselves.
But this obviously, so we don't have to have disclaimers all over the show. And people need to know it's a real interview. I'm not siding with you. I'm not endorsing you. I'm just asking the questions.
Right.
But you've had patients on medications that are now off medications.
Correct.
In your hands. And this company, TruDenta, they have over 1,000 people that have been through the program. And they have, and how do you find out more about this?
You can go to our website, or you can go to the TruDenta website, which will lead you back to us.
Okay.
This system is incredible. I mean, there are over 1,000 people, and I'm sure those numbers have to be updated now, because I go to meetings, and I go to TruDenta meetings, and doctor after doctor after doctor is saying, oh my gosh, we had this patient that we helped, and we had this patient. I never dreamed we could help that patient. And it's just one.
So other dentists are telling you.
Yes.
Have they ever told you, like at a break, and they say, you got to do this?
Oh yeah. Yeah. I mean, and that's, Dr. Montgomery is the one that pulled me aside about a year ago and said, you've been doing this other system for a while, but you're not having the success you want. You really need to do this. And looking back, I wish I would have done it before, but the system wasn't there too long ago, but I wish I would have done it long before. So, it's just amazing how many people have been helped and how many lives have been changed by this therapy. every single day we see patients in our office who are coming in for headache therapy, who Krista's, through our team's efforts, are being able to help. They're becoming headache free. We're seeing like 15 patients a month that we're getting over the hump. And every single one of our patients has seen marked improvement.
So far, your track record with
Yeah.
this TruDenta technique, which is a comprehensive, it's like 5 or 6 things you're doing,
Right.
in addition to splint therapy, ultrasound, laser
TENS.
therapy, TENS unit, and physical therapy of the
Right.
jaw. Did I leave anything out?
Not to mention the home care, because you know,
Okay.
we can only do so much. The patient has to bear some of that on their shoulders too, with some exercises they do at home, some home TENS units, and so forth, as well as watching their diet and watching their exercise and so forth.
And everybody you have dealt with, I don't want to put words in your mouth here,
No.
has gotten better. They say, yeah, I'm much better.
Yes.
Because because I said, how many people do you currently have in treatment? At one time, you said more than 20.
Yeah.
So more than 50% of these people, they've gone away.
Oh,
The
yeah.
migraines?
Yeah, even
More than
that.
50%?
Yeah, more than that. Way more than that.
But if somebody's watching this, if they go in for a consultation,
Mm-hmm.
with what certainty can you tell them you'd be a great candidate?
Well, you know, we look at the obvious signs. We look at what kind of pain they're having. Is it headache pain or jaw pain, TMJ pain? Do they have worn down teeth? Do they have big jaw muscles? Do they have, you know, lines on the inside of their mouth where we know they've been clenching their teeth together, or lines on their tongue where we know they've been clenching their teeth
Interesting.
together? When we see those things, we're pretty darn sure that we can help them and get them to a much better state.
Okay, good. We're going to take a quick break. We come back.
Okay.
More, again, about the process and a little bit more about how it works, the mechanism.
Okay.
You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
I have been migraine free since September, and it's amazing. Everything's more clear at work. Everything's clear. I can focus a lot more. I have a lot more fun.
And after going through the therapy, I felt like a new person. Sorry. I haven't had a headache in 3 days, where I suffered for 3 before we came. And I slept great and feel wonderful.
It's just overwhelming to know that maybe life can be so much better than what it's been. And, you know, being able to smile and be excited about the day instead of thinking, okay, how am I going to get through tomorrow?
It doesn't really hurt anymore, and I can open a lot wider. Before, everybody would say that I was mumbling. Now it's like I don't have to repeat myself, and I don't mumble anymore.
You're watching The Wellness Hour. I'm Randy Alvarez. Today's topic, no more migraine headaches. With us, we have Dr. Greg Pyle, who's getting great results with his patients. Okay, Dr. Pyle. So you say that people that, and we're talking about migraine headaches, and for people that miss the first part of the show, you're saying that the way their teeth come together
Right.
is aggravating nerves
Exactly.
and
And muscles.
can be linked to migraine headaches, and
Right.
you're seeing results with your patients.
We are.
Reversals. In fact, your stats of how good you were getting results,
Right.
I wouldn't even allow you to use on the show.
Okay.
Is that
exactly.
true?
That is true.
Okay, because that sounded too high. I said,
Yeah.
well, I don't want to get in trouble.
Okay.
But you're getting great results. I mean, it's more than
Yeah.
50, 60, 70% of these people
Yes,
with
definitely.
migraines. You've had one woman 10 months straight with migraines. After 4 sessions, migraine's gone.
Right.
Okay. And you have people on medications that are no longer taking
Not
medications.
taking their medications anymore.
Okay. But you say, and this is very interesting, you say people that were in car accidents or had their jaw jarred, fell out of a tree or whatever.
Right. Yeah, that's
Yeah,
another group of people.
Why?
I mean, for them, their issues weren't self-inflicted, if you will. They're not necessarily grinding their teeth, or maybe they are now, but maybe it was due to a past accident that they had. And most people, you know, when we ask them in their evaluation, were you ever in an accident? A lot of times they say no, and I say, gosh, you've never had a car accident at all? And they say, well, yeah, there was that one. I said, well, did anything happen? Well, maybe I hit my head on the steering wheel, but I walked away. It was okay. And what we find, it's kind of funny that people will, you know, if you hurt your shoulder, they immediately go to the orthopedist and they say, gosh, you know, I'm wanting to lift weights, or I want to do this or that. And they get treatment on their shoulder, but they hit their head on the steering wheel and they walk away and they go, I must be fine. And what we're finding is even the most minor accident can lead to long-term headaches down the road for these patients. And when we dig deeper and dig deeper, we a lot of times find that many of these patients have in fact had an accident in their past.
So when you jaw the jaw, okay, so when the bite gets off, when you're awake and especially when you're asleep, you're moving your jaw, right? Your teeth are trying to come together perfectly and they can't find the right spot.
Your brain's trying to find that spot subconsciously. You don't know
and that's
it.
why you grind.
And so you're going, something's
so it's like
not right
tension here in all the muscles.
Right. And a lot of times that is all caused from a past accident where maybe a whiplash and now the musculature is not supporting the head just right, and so their posture is bad, and then the jaw position might be changed a little bit, and so then they're constantly trying to get to that correct position. And that's what the TruDenta therapy does, is try to get all these muscles and teeth into the right position.
Now you had a woman, you told me, in my green room, you said, Randy, they don't have to have any symptoms. You had a woman that just had neck pain.
She did.
And posture problems.
Right.
And migraines.
And migraines.
So how did she end up with you, though?
She was actually a patient of record. And she...
you overheard the story? And
she was telling our hygienist, you know, my neck hurts when she was reviewing her health history. And I said, well, let's talk about that neck pain. Well, she works at a computer all day. She's a librarian at the university. So she tends to have bad posture while she's doing that. But the big part is what we found after asking a few more questions was she did in fact have headaches and migraines.
And she was just in for a cleaning?
She was just in to get her teeth cleaned. And we just hadn't in the past dug deep enough to ask her the right questions to find out, what was really going on.
So were you excited about this, by the way?
Yeah, it really...
Well, you thought, okay, let's see if this works with her.
It really fired me up because this was in the beginning of the TruDenta therapy. So we really didn't, even the doctors and the staff were a little bit skeptical. And so we said, hey, let's see what happens here. I think we can help her. So what we did with her is we made a bite guard or an orthotic, which takes her teeth apart, which doesn't allow her to clench her teeth, which I think she was doing when she was
leaning. At
leaning.
This was at night?
She wears this at night, but it also kind of trains the muscles for during the daytime when
Okay.
she's leaning forward looking at her computer. I think she was maybe clenching at that time too. And so it keeps the teeth apart, which in turn takes all the pressure off of this TMJ and all the musculature around that. Then we put her through 8 therapy sessions, which we again used the TENS unit and the ultrasound and the cold laser and the manual muscle therapy. And we put her through those sessions. And now when she comes in, she looks completely different. She's sitting up straight. Her neck is back in a more straighter position. She's got a smile on her face. And she's just more energetic and has more life to her because of the TruDenta therapy. And the best part of the story is she doesn't have headaches anymore. She's completely headache free. She's told us that on a couple occasions she felt one coming on. She did her neck exercises. She used her home TENS unit. She watched her diet for a couple of days. No dairy products and those types of things.
So you do an anti-inflammatory diet too?
Yes.
Interesting.
Yes. And those headaches go away. So even though we can never guarantee that you'll never have another headache again, we can guarantee that you're going to have a method and ways and means to fight a headache when one comes on, and it doesn't involve drug therapy.
Insurance does not cover this. I know the cost, but over time, it's less expensive over time than drug therapy. Than somebody's copay for drugs.
By a long shot, yeah, over time.
We have about 2 minutes left.
Okay.
And we're going to interview I guess you call her a therapist in the practice. She's the one that is working with these patients.
Yeah.
So she's a therapist.
We kind of came up with we came up with a new title for her, dental headache therapist. And her role is actually doing the therapy sessions. So she has been trained and she goes through and she knows how to use the cold laser and the ultrasound and the TENS unit, as well as how to do the manual muscle therapy. And she knows about the muscles of the head and neck and how to stimulate those and how to push on trigger points. And she goes through, and like I say, these sessions last about an hour to an hour and 10 minutes. And just really changing people's lives.
And that's why I want to talk to her, because I want to hear from her what the results, what she hears from patients. She probably hears things that you don't hear.
Oh, I'm sure she does.
So that's why we'll get, and her name is?
Krista.
Okay, Krista. Krista, welcome to the program.
Thank you.
Now, your role as a therapist, Dr. Pyle comes up with a diagnosis. You're the one that's actually doing the treatment plans, is that right? Give me a typical what you do with a patient.
So after Dr. Pyle figures out which level the patient is between 1 and 4, then the patient comes to me, and I treat them with a variety of modalities, including the ultrasonic therapy, manual muscle manipulation, the laser therapy, and electrocurrent therapy with a TENS unit.
Okay, Dr. Pyle says you guys are getting great results. I mean, do you have patients that had migraines that no longer have migraines?
Awesome results, awesome results. Every week I'm finishing up with a patient who is headache-free. Headache-free and drug-free. They're off of the Advil, they're off of the Maxalt, whatever their prescription migraine medication is, they're getting off of these medications.
Give me an example, by the way.
Yeah, just last week I had a patient finish her 12th therapy session. And this patient, she was not able to hold a job for the past year. She couldn't even really get up off the couch. It was affecting her marriage. She just was really at the end of her rope. She had spent more than $10,000 out of pocket on alternative medications, with a neurologist as well, and nothing was helping her. And now she's completely headache-free. She looks like a different person.
Now, what do you mean she looks like a different person?
Oh, the first time I saw her, she just looked so broken. She was hunched over. She couldn't open her eyes. I mean, she walked in here with a full-blown migraine, and she was ready to give up. And now she walks in here and the whole office sees she's just lit up. She looks younger.
What does she say to you, by the way?
That she loves me.
What are they usually skeptical?
Oh my goodness, yes, absolutely. She was just, like I said, she was at the end of her rope and she was willing to try anything.
Are you surprised? Are you surprised at the results?
I really was at the beginning. I'm not surprised now, but when we first started doing this, I was very surprised. I really didn't know what to expect, but I went through the process as well.
You had migraines?
So, I did, yes.
Interesting. Okay, thank you very much, Krista, for coming on the program.
Absolutely, thank you.
Well, we're out of time.
Yeah, that is not, by the way, that's not an exaggeration what she's talking about. We are seeing so many people that are helped by this therapy.
So come in.
And she's an incredible therapist too.
Good. So come and get a consultation, meet with Dr. Pyle.
Yeah, come in, call our number, see our website. Our number's at the bottom of the screen here. Give us a call and we'll get things rolling for you.
All right, thank you so much for coming on the show.
Thank you so
Very
much.
interesting. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again, you just caught 10 minutes of it. Especially if you have a migraine headache, you could go to our website, just put in Dr. Pyle, and you'll see it there. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.